did have some other things that have happened since your Health Writers Conference.
Hmm.
One of them was the really interesting, I thought at least, conference by the Network of the National Libraries of Medicine. It was
Hmm.
called NNLM on April 4th and April 5th, 2023. And, there's some wonderful advantages and disadvantages to having all of this on Zoom.
Hmm.
Advantage, it's recorded, I can fold my laundry while I do it. Disadvantage, I can get pulled away by my family to pick up them from XYZ appointment or whatever the case may be, and it perhaps doesn't have the same amount of attention
Yeah.
to that matter than if I'm in a room with 30 like-minded individuals having a discussion on XYZ topic. Another plus, though, is having access to all these wonderful videos that we can share with our audience,
Hmm.
because I do think that they brought up so many important points. Those of us who attended the conference, we only have access to the recordings until May 4th from the
Right.
conference site, but they are making them available on the NNLM. Again, that stands for the Network of the National Library of Medicine's YouTube site. So you can get access to some of the really, really stellar presentations that they had there. One, for example, the reason Marika and I are so focused on this is because we were looking at the challenges that we faced during the pandemic due
Hmm.
to misinformation versus disinformation. And Marika did a very wonderful blog piece on that. Way to go. And also did a really nice video clip for us that went around on Instagram and TikTok. This is such an important issue to the two of us. We wanted to elaborate a little bit further, and more importantly, to provide resources for all of you guys so that you can develop the tools necessary to be critical, curious thinkers when you hear new medical information. And some of the most interesting pieces that I thought from the NNLM conference was they had one that had a toolkit for, quote, disassembling healthcare information that is misinformation or disinformation. They had one on critical cultural literacy.
Hmm.
There was also one thing that I really appreciate is that they did one that was a game room, or they were gamifying it. So they had an escape room. And again, that was on building skills to approach identifying health misinformation versus disinformation and building up your health literacy. And there was a really, really interesting guy from the University of Cambridge. His name is Jan, and he's one of your compatriots, Marika. Last name is spelled Roozenbeck, Roozenbeck, and he has that beautiful Dutch accent, just like you. But he was talking about an app that he created
Hmm.
to help individuals be able to predict what disinformation and misinformation may develop,
Okay.
and to make them, he described it as being inoculated. So for example, when we
Oh,
get a
okay.
vaccine against shingles,
Right.
we're getting a small dose of the virus that causes chickenpox or shingles, but we're ramping up our immunity to that
Hmm.
virus. So with this gamification app that he has, again, he's trying to give you little tidbits of what misinformation and disinformation may look like, so
Hmm.
that when you are later confronted with it, you can be like, oh, that's a whole bunch of malarkey. I need to investigate this further. Let me get curious.
Hmm.
So it was pretty powerful. And they talked about in the US, you may know that there are some differences in viewpoints about the pandemic, just a wee bit. And they were talking about how people were trying to come together with differing viewpoints on a topic, and how they might engage, empathize, and educate. And the key thing was to remain curious,
Mm-hmm.
and to let the individuals know that you're hearing what they're saying.
You
So,
bring up a really good point there, Karen, because one of the sessions that I sat in on was how to, it was explaining the difference between misinformation and disinformation. And just very briefly, misinformation is incorrect information that is inadvertently passed on. It's not a deliberate thing. So I'm getting my hair cut. I hear two people sitting next to me talking about something. It makes a lot of sense. Wow, that's really interesting. And then I tell somebody, not realizing that it's not true because it made sense to me. So I wasn't maliciously spreading bad information. I just heard something and thought I passed it on. Disinformation is the information that the conspiracy theorists and people who want to make money off of you, they're deliberately sharing the bad information. So the most well-known case is the one for autism and the vaccines. That was definitely disinformation. He knew it was wrong and he still published it and caused a lot of harm.
which, also, just the need for all of these clinicians to publish
Yeah,
and to have that kind of moment of airspace and look, I got published in XYZ
yeah,
prominent journal, and you know everybody wants to create some level of controversy because that's what bubbles to the surface, that is
exactly.
clickbait, so
But what
that
was
we
super
stop and
interesting,
look.
what was super interesting about, excuse me, this particular session, and I've heard this before, is how we counter it. In another, not this meeting, but a different one, I read and heard that we shouldn't use words like fighting and combating because right away that sets us up, right? Us against them. It should be
Uh-huh.
countering, right? We're countering it. So if somebody spouts something that's incorrect, don't get mad at them and go like, you idiot, you believe that? How on earth could you believe that?
Mm-hmm.
Don't get angry, don't get insulting. Try to understand why they believe it. If it's misinformation, it's not their fault. Well, even if
Right.
it's misinformation, it's not their fault if somebody fed it to them. But
Right.
you're not going to get them on your side by getting mad at them.
It does seem like a fair amount of the the information going about is trying to trigger our amygdala. You
Yeah.
know, whether it's a picture of a poor baby that has not been vaccinated, that's dying of smallpox from years past, or um, uh, just we do have to take that pause,
Mm-hmm.
take a deep breath, and try and you know push those emotions or feelings back and kind of think
Mm-hmm.
about it a little bit more. So that same guy, Jan Rosenbeck, he developed the term pre-bunking, you
Yes.
know
Getting the
and
information out beforehand.
right. So just trying to prep people a little bit more for what to expect, how to get curious, how to look at data, how to ask additional questions,
Yeah.
that kind of thing. So it was pretty interesting. And he used the term building psychological immunity against online information. And so his fake news game was called quote unquote bad news. So it was really in the game, the players walk a mile in the shoes of a fake news creator.
Oh, wow.
And so by walking in the shoes of this fake news creator, they then became more empowered as to when they would recognize misinformation or disinformation. Yeah. So it was pretty interesting. Yeah. Yeah.
Well, the other thing is when we're explaining things to people, what I often say, and you too, is what is the basis behind it? So if you're receiving disinformation, it's usually because somebody wants to create some sort of chaos, or they want to sell you something. They want to sell you a quote unquote drug that will cure you or prevent you from becoming sick. So it goes back to the always and never that I often talk about. Any
Yeah.
website or any so-called professional who uses the words always and never is probably trying to convince you because in medicine and science, there is no always and never. Things constantly change. And that also
Yeah.
brings us back to people may find it hard to believe researchers and medical people because we say one thing one day and then a few weeks later we say something different. But that's because science and medicine are constantly evolving. In the
Wow.
in the 70s and 80s, when I was studying nursing, for pain relief, we had Demerol, morphine, codeine. And I remember going to a conference and then spouting the same information myself. At that time, you couldn't become addicted to those drugs if you had pain, because when you took them, they took care of the pain. And then once you no longer had the pain, you stopped taking them, right?
Yeah.
If you took them because you didn't have pain, that's when the addiction happens. But that was pre-fentanyl and pre all this other stuff. So if you
Well,
look at stuff that
you,
I wrote in the early 80s and I said you don't get addicted, at the time you didn't, right?
there was also because a lot of the large studies that were coming out, even the famous one that was mentioned in the New England Journal of Medicine that I put in my blog on pain, the key thing was that these were hospitalized patients receiving IV
Yes.
pain medications. And what happened in the 90s was they were all of a sudden converting this to oral medications, and they were making them readily available to people who are dealing with chronic pain, and they were promoting them as a way for them to continue to work in their heavy labor job, you
Mm-hmm.
know. Yeah. Yeah.
And
So
it's frustrating because, like I said, science changes. So
yeah.
we thought of it pain and narcotics and opioids one way in the 80s, and then all of a sudden
Mhm.
we had to switch it. And it wasn't because we were wrong, it was because things evolved. And
Right.
at the beginning of the pandemic, wear a mask or not wear a mask. Some people said wearing a mask was useless, and they said wearing a mask is helpful. But again, as the studies happened and as we lived through the pandemic, then we
Mhm.
started to learn masks did help, but they had to be certain types of masks. And it
Right.
wasn't because we were wrong in the first place, we were working with what we had.
Right. And I think one of the challenges that we face is kind of the standard, or gold standard um, um, laboratory study would be a double blind placebo controlled study. But you cannot do a double blind placebo controlled study when you're talking about masks, because you see the mask on the person or you see the mask off the person. So you are not blinded. You are
Yeah.
seeing the difference that is happening in that community.
Mm-hmm.
And then you can't go in a week later, 2 weeks later, and switch it to the other group and then look at infection rate, because there are so many other variables that are
Exactly.
uncontrolled for that. So definitely is a challenge as you look back at some of these studies, and uh, it is just extremely challenging trying to control for the population that's being studied, the location, the infectivity rate in that area, what was the R naught at that time, which
Mm-hmm.
strain was going on,
Mm-hmm.
what sources were available. And definitely, I think we will be teasing that out for a good long time, hopefully before the next pandemic happens, we'll have a better sense of what's happened. But it was, I was just so incredulous that it seemed like we were um, going through the same history that happened during the flu pandemic.
Yeah.
Like, I had done a bunch of research on the flu pandemic even before
Mm-hmm.
COVID happened, and had done a whole 1 hour chat session on the flu pandemic. And they were all about wearing masks.
Mm-hmm.
They still wanted to have their college football games, but everybody in the stands had their masks on, and they went through the same kind of waves that happened just like we did. And the waves were much more severe, the more tightly packed communities
Yeah.
with low income housing, where people were working jobs that did not allow them to isolate. They were much harder hit. It was very, very interesting
I remember
seeing this
reading
happen.
I like reading historical fiction, especially from the authors who really do their research.
Yeah.
And I don't remember the name of the author, but it was several years ago. I read a book that took place around the time of the Spanish flu, and this particular author is well known. I can't think of his name, but he's very, very well known for his research. And in the book, he had this village that was the mayor had sealed it off because he knew that if anybody came into the village, they would bring the flu. Sealed it off. They stayed so safe for the longest time, but then one person snuck in and he wiped out the village.
Wow.
And
Wow.
I'm sure that happened.
Oh, it happened a lot. And one of the interesting, there was a really interesting book on the flu pandemic that talked about how they went back and um, excavated some of the remains from the flu pandemic in Alaska because the permafrost
Right.
had allowed enough melting for them to pull up some of the bodies there to actually type the flu virus that caused the flu pandemic. Interestingly, it was called the Spanish flu because uh, it was during World War I, and all
Yeah,
the other countries were limited on how much they could talk about the pandemic,
that's right.
whereas Spain was independent. So Spain was the first one to really say, "Oh my gosh, there's a horrible virus going around, and a lot of people are dying."
Yeah.
And even though it originated from the middle of Missouri,
Hmm.
at an army base there, somehow it was labeled as the Spanish flu. You
Yeah.
know?
Yeah, it's quite something, and too bad we didn't learn. I mean, we learned a lot from them, but unfortunately not enough.
Well, hopefully we can help people understand how to be curious. And
Yeah.
it's okay to trust, but consider investigating too, you know? Or what was it saying? Trust but verify?
Yeah.